Hi, this is Nora De Silva. I have brought you another success story today. The hero of my story has been awarded with a priceless prize, which is life itself. She had fought the cancer, and today she is with me to share her journey. When did she find out about this illness, and what she did, and what was her reaction, and how did she get through all the treatments? Let's welcome Huda. Hi Huda, how are you?
Hi Noor, how are you?
I'm good, thank
Good,
you.
thank you.
Thank you so much for coming to my show today and your willingness to share your story with us.
My pleasure. Thank you for having me in your show.
Thank you, my dear. So tell me, how did you find about your cancer?
First, I felt the lump
Okay.
and irregular shape. I thought it will take just 2 days and will go away, just like other swollenness or something like that. But I was worried, so I just said I wanted to have a peace of mind. So I booked an appointment with my family doctor, and my family doctor was concerned, so transferred me to do an ultrasound and mammogram. So both results came suspicious, and there is a lump, and that have to be removed by a surgery. And however, they have to know if the lump is whether benign or malignant. So I underwent a core biopsy, and a week later, the surgeon, my surgeon who will do the surgery, told me the shocking news that I have cancer.
Okay. What was your feeling or reaction as soon as you knew that you had cancer?
Shocking was my first reaction. I was anxiety, and I was sad. I was all the questions that come on my mind that's related to, oh, I will die. I felt the time stopped. I even didn't know that where I was. Where is this place?
Okay.
I didn't understand what the doctor told me. I told the doctor, so please, I need to go home. I need to absorb the news, and then I come back for more details.
Okay.
So, but this disappeared in 1 hour, and
okay.
Yeah.
So tell us now about your treatment journey.
After the MRI results came, that I have a cancer mass that's a size of a golf ball, and it was a stage 3, and I have to take the chemotherapy along with another treatment, which is the trastuzumab, or it's called also Herceptin, and the chemotherapy called Taxol. I used to take it. All this called a targeted treatment, directed therapy.
Okay, what does the chemo with the other medicine that you mentioned, the targeted therapy will treat? What does it work on?
The chemo worked on breaking the cancer cells, make it disappear, and the Herceptin worked on cutting the feed to the cancer cell. So it will, because the cancer cells are taking
Their
energy, their food from the hormones.
Okay.
So they have to cut the hormones.
Okay.
So to cut the feed to the cancer cell. And
that was before the operation,
yes,
right? You took the chemo because the location of the lump was in a place that had to be removed. The
Yes.
size has to be decreased first.
Yes.
Then they would do the surgery for you.
Exactly.
Okay.
And the chemotherapy, I used to take it for 6 months.
Okay.
At the beginning, it was every 2 weeks. Then it will change to every week. the chemotherapy session, the one session was for 4 hours, and before the chemotherapy, I have to do a blood test to check all the results, all the readings are okay to have the chemotherapy. Sometimes the blood iron or the other minerals are low, so I cannot do the chemo because the body will not have the full energy for the strong treatment. And
so how long like the session will last for? Chemo session, is it 15 minutes, 1 hour?
The chemo will long last for 4 hours.
4 hours each time?
Yes.
And what was the side effect of the treatment for chemo?
I have a long list.
Okay.
But I will say some of the obvious side effects.
Yeah.
First, nausea and vomiting.
Okay.
Fatigue.
Okay.
Of course, hair loss.
Okay.
Hair will fall. I'll be bald.
Okay.
But that's okay.
Okay.
And change in the skin color.
Okay.
It will be pale. It will be dark.
Okay.
The nails will be weak and it peel away, fragile, and it will be black.
Okay.
So that's very painful and hard to do the small things in everyday life. Also, the heart will be very weak.
Okay. You said like maybe just going 3-4 steps you would feel out of a breath.
Yes,
Yeah?
that's you
Exactly.
cannot move.
Yeah.
Eye redness and weakness and dryness. It's blurry vision.
Mm-hmm.
I will not be able to drive a car for 6 months.
Yeah.
Because of the always dizzy and confused.
With even the other symptoms, like as
Yes.
you mentioned, it is hard to drive.
It's hard to drive.
Yeah.
And change in mood also because of these other
hormones.
symptoms.
Yeah. As well, you're taking medicine to stop one of the hormones, right?
Yes.
So this will as well affect the mood.
Yeah, it's a big war.
Okay, big war. Okay. So you said as well there was radiation in the treatment.
Yes.
And what does the radiation treat?
The radiation treats the remaining of the cancer cells after the surgery and after the chemotherapy.
Okay.
There may be remainings that have to be removed. So the chemotherapy cleans the area and less the recurrence of the cancer come in the same place. Also, the radiation have no side effects, only maybe change in the skin. Change in the skin in the place of the treatment, and the radiation will not make the person radioactive, so it will be safe to be among people and including children.
Okay.
So this because I know some people said, oh, you have radiation, you may affect others around you. No, the radiation doesn't. It's safe and it's painless.
Okay. So for how long like the radiation session would go for, and how many times per week?
The radiation session will last for 20 minutes for 5 weeks. Every day, continuous.
Every day, okay.
Yes.
What is the food that the doctor recommended for you to eat through the treatment and healing time?
For the recommendation of the doctor, he told me to eat healthy food, cooked. Everything should be, if it's meat or seafood, or it should be cooked, it should be fully cooked. Avoid raw meat, avoid raw seafood, sushi, all this type of food. It may contain bacteria that will be harmful for the body, and the immune system is 0, so we have to be careful. Avoid any drinks with caffeine. and pop drinks. So no coffee, no tea, no Pepsi, 7-Up, all these type of drinks to avoid. Of course, for people who have the habit of drinking alcohol or smoking, they have to stop immediately. There is some type of food that aggregate the side effects of the chemotherapy. Most of them are grapefruit, pomegranate, like this type of fruit we should avoid. Also, about the sugar.
Okay.
The sugar. Everybody, they have a myth. There is a myth that the sugar will related to cancer.
Yeah, because this is what we got to learn, that the cancer will eat sugar in order to grow. This is the cancer food. This is what all we know.
Yeah, but ask the doctor. The doctor says sugar has not related to
Has no
cancer.
relation with cancer.
But of course, we will not go and dig your head in the sugar.
Yeah.
No, so we will eat like
Natural sugar.
natural sugar, normal amount, and preferably the fruit source.
Okay.
Like this is the natural source of sugar.
Okay.
Fruit, dates.
And you mentioned as well, when you are in this situation, the best resource is your doctor. He would tell you what to eat. Maybe each case is different as
Exactly,
well.
exactly.
Yeah.
Each case is different. Like even all the symptoms and all the treatments that I said, for me, it's different for each one.
True.
Yeah.
Okay. How did your life has changed since you knew that you had cancer? What the things that you used to do and you weren't able to do it through the treatment time?
It's changed everything in my life.
Mm-hmm.
My whole life
Has
changed.
Did you used to work as well?
Yes, I used to work, so I have to stop working.
Okay.
Because even if I can work, I will not be able to commit to work because
all of the side effects. And
all of the
medicine.
side effects, and also I will be going to the hospital a lot, so I will not achieve anything in that day.
Okay.
And
This is work-wise. What else?
no driving a car, never,
For 6 months.
because also of the side effect.
Yeah.
It's even after I'm healing. I'm okay.
Yeah.
My life changed.
Yeah.
My thinking changed. I am more confident. I know what I'm capable to do.
Okay.
The things that I thought I couldn't do before.
Okay.
So I know that I'm more strong.
Okay.
Of course, I don't wish anyone to go through the same circumstances to feel that.
Yeah.
But the thing that this situation I've been through, make me know my capabilities and my strength.
Yeah.
Everything in life change. I prioritize more to my family, to the people that around me, to people who respect me. Yeah.
Okay. So how did you use to make yourself busy through this time? So as you said, many things like your health has changed and many things became weak in your body, but there are still things you could have done, like puzzle, coloring, knitting, watching some nicer programs you like, anything. How did you spend your time?
Of course, it's good to have some hobbies that we can do.
Yeah.
Not the sport hobbies, of course. The one that we can spend time at home.
Yeah.
So I do like paintings, artwork. I will make myself busy with talking to my friends. Talking to people is healing. Mm-hmm. Also telling jokes. Laugh a lot. This will really make your spirit go higher.
Yeah.
Always reflect to your religion and spiritual things. Life. This will really increase our inner strength.
Yeah.
Make your faith stronger.
Yeah.
Only faith can make us go to the end of the treatment, and really change our life for better improvement.
Oprah Winfrey say, reflect to the greater power.
Exactly.
I name it God, you name it whoever you want to name it, but there is always a greater power
Exactly.
that created us. We need to reflect back to this power
Exactly.
to be able to get the strength. As
Exactly.
we are weak, and maybe a small virus or a small
Or-
bacteria
Exactly.
would put us in bed and we cannot do nothing. We
That's-
have to reflect to God in our
Exactly.
in my religion.
Human being
Limited.
is so weak. Human being is
Weak
so weak.
and limited.
Exactly.
Yes. What do you advise all the women to do, like regular checkup? What else, like it is like advisable?
Health is very important. So whenever we feel tired or weak, or just rest and sleep. Sleeping is like we need to sleep enough,
Yeah.
Especially for a woman who is working.
Yeah.
You need to sleep enough for your everyday life.
Okay. As you
And-
said, you put a priorities. Before, maybe
Yeah,
you
before
used to push yourself.
exactly.
Okay, I'm tired, I will not sleep, I need to clean, I need to do this for the
Exactly.
kids, I need to go shopping, I need to do this and that.
Exactly.
Now you know Huda is number one. When you're tired, when your body needs to sleep, it means that's it. I have to shut down and turn off everything else, and I'll go to sleep, rest, or eat healthy food, or do what your body needed.
Exactly.
Yeah.
Like if you feel work is stressful, just take a break. Don't let this stress affect your life. Always think positive. Like, yeah, health is very important.
Health is wealth.
Health is wealth. Yes.
Okay.
Yeah.
When you have the health, you can do everything you want.
Exactly.
When you lose the health, you cannot do nothing. So in order to keep the health, do all the steps, take all the good food, take
Good
me
food,
time.
drink a lot of water.
Exactly.
And yeah, just if you feel anything in your body, just visit, go to the doctor for checkup, full checkup, blood work, and all this type of checkups.
Necessary.
And hope everybody will be
Healthy.
safe, healthy and safe.
And safe. Okay, my dear Huda. Thank you so much for coming up to my channel today and your willingness to share your story, your journey to fight this cancer, and in order to share the awareness between the women, to put the spirit up high, to do checkups, to prioritize their duties and put themselves first. And this is how we can help others, through your experience.
Thank you so much for having me, and I wish people will get use of this video, and everybody needs go through the same situation and need any positive talk. I am happy to do that. I'm happy to help for any information.
And they can contact Huda to give them assistance. Yeah, why not?
Contact Noor first and then.
Okay, sure. They come to me, then I'll give them your contact. No problem. Done deal.
Thank you.
Okay, thank you so much, guys and girls, for watching us today. I hope this episode will be useful to you as it was useful to me, and I promise that I'll bring everything useful, new, and interesting. Thank you for watching. That was Nora De Silva. Have a great one.